In this video, we're going to learn about the process of atherosclerosis and how it affects arteries and blood pressure. And we also need to know about some of the other diseases that are caused by having atherosclerosis. So atherosclerosis is caused by the accumulation of fatty materials, mainly cholesterol, and other materials such as fibrous material and calcium. Now these form a structure called an atheroma, or a plaque, beneath the endothelium of arteries. As the atheroma grows, the artery becomes thicker and it loses its elasticity, so it is less able to expand and recoil to accommodate the surge of blood flow. Additionally, the diameter of the lumen becomes reduced, and this restricts blood flow and increases blood pressure. The narrower lumen means that the blood pressure becomes raised. You can see on these microscope pictures of arteries, on the left we have got a normal artery with the connective tissue round about the outside, then the smooth muscle layer, and then the endothelium. And then there is a nice lumen for the blood to flow through. The diagram on the right shows the connective tissue and the smooth muscle, but you can see there that the lumen has become partially blocked by this area of plaque or atheroma. That has reduced the size of the lumen, and blood pressure in that part of the artery will be increased. So the reasons why atherosclerosis is potentially dangerous. It makes arteries narrower, which thereby restricts blood flow to organs and reduces the ability of those organs to function properly. If atherosclerotic plaques rupture, this can cause blood clots, and if the blood clot blocks an artery, it can lead to a stroke or a heart attack. If a piece of the blood clot breaks off and travels to the lungs, it can cause a pulmonary embolism, which blocks the arteries in the lungs. You can see here some coronary arteries, okay, and you can see this one here is blocked by plaque. All that yellowy material is plaque. This one here is blocked by a blood clot, a thrombosis that has occurred when the plaque has ruptured. Okay. This picture here on the right hand side shows severe atherosclerotic plaque in an artery where the lumen is virtually completely blocked by the plaque. Okay. So depending on which artery is involved with atherosclerosis, there can be different effects in the body. Okay. So we can see in the top picture there, the artery is normal. It has got a normal sized lumen. We then have a small plaque developing in the next picture down. That plaque gradually grows in size to form a significantly sized plaque, which vastly decreases the size for the lumen. And then at some point that plaque may rupture, causing a blood clot, and that causes complete blockage of that artery, completely cutting off the blood supply to whatever organ. All right. This is the left coronary artery branching off the aorta. You can see that here. Okay, and you can see that this part of the coronary artery has severe atherosclerosis, so you can see the yellowness of the plaque along it there. Okay, and you can also see this area of really significant narrowing here. Right. And that has really reduced the blood flow, and that would be causing complications for the heart for that patient. Okay, here we have a normal coronary artery with a nice unobstructed lumen. That will be providing plenty of blood to the cardiac muscle. This one here, the coronary artery is severely narrowed by an atherosclerotic plaque, and this could lead to symptoms like angina, which manifests itself as chest pain, reduced blood supply, or a myocardial infarction or heart attack if that artery becomes completely blocked. Okay. Again, you can see that this coronary artery has become quite significantly blocked with the atherosclerotic plaque. So, atherosclerosis is the root cause of various different cardiovascular diseases. Angina, which occurs when the blood supply to the heart through the coronary arteries is restricted. It's not completely cut off, but it is restricted. This causes chest pain and breathlessness. A heart attack, which occurs when the supply of blood to the heart muscle through the coronary artery is completely blocked, usually by a blood clot. A stroke, where blood supply to the part of the brain is cut off, again, usually completely blocked by a clot after being narrowed by atherosclerosis. And also peripheral vascular disease, which is narrowing of the arteries due to atherosclerosis, but the arteries are not in the heart or the brain. It's usually in the legs. Okay? And sometimes peripheral vascular disease in the arteries of the legs can be so severe that people actually have to have their legs amputated. So, what are the risk factors for atherosclerosis? Smoking greatly increases the rate of atherosclerosis, as does a high-fat diet, because the main material that forms the plaques is cholesterol. A lack of exercise will increase the risk of atherosclerosis, as will being overweight or obese. Having either type 1 or type 2 diabetes can also increase your risk of atherosclerosis. And having high blood pressure. High cholesterol will also increase your risk of atherosclerosis.